Hello everyone. Thank you, Dr. Dragon, for a wonderful presentation on fractures, and he has covered up a unique aspect taping on fracture. We'll now move on with the academic session 6 of the day of First International Kinesio Taping e-conference. We have Dr. Nihan with us now, and she is also a professor. She is a member of the KTI Education Committee. She has presented and published extensively on kinesiotaping and supervises advanced student research. She received her bachelor's degree at Docker's Elliott University, Izmir in 2006 as a physical therapist, followed by her PhD in sports physiotherapy at Hacettepe University, Ankara in 2013. She came a CKTI in 2011, Milano, Italy. Nihan is a faculty member in the Department of Physiotherapy and Rehabilitation, Faculty of Health Sciences, Buskent University. So I warmly welcome Dr. Nihan and thank you so much for accepting my invitation on a very short notice. Thank you, Dr. Nihan. Over to you.
Hi, my name is Nihan Ozunlu Pekyavas. I am a sports physical therapist. I am a certified kinesiotaping instructor since 2011. I am also a member of Educational Committee in Kinesiotaping Association International. I work as an associate professor at Buskent University, Faculty of Health Sciences, Department of Physiotherapy and Rehabilitation. Firstly, I want to thank the organization committee for this wonderful event, for this e-conference, because it's the first in the world with Kinesio tape, and I think it's very successful. Today we will talk about the effects of Kinesio tape on edema. Does it really work or not? Now, let's look at what edema is. Edema is the swelling of soft tissues as a result of excess fluid accumulation. It is a result of inflammatory process, of course, and it can happen because of trauma. It can happen because of postoperative procedures. It can happen because of the absence of lymphatic nodules as lymphedema. Lymphedema is another concept, another thing from edema, and it must be considered very seriously. Now, looking at how kinesio works on edema is that space movement cooling concept helps us with kinesio to work with edema. Space movement and cooling are always with each other, and space will be changing a relationship between tissues, which will provide us better fluid movements. Movement will be sensory motor coordination changes through tactile stimulation, and with these two, cooling will provide better biochemical environment for our body. Considering Kinesio's hydrodynamic theory, a body is thought as a washing machine. The clean body fluid flows in the capillaries, is like the water in a washing machine. It gradually cleans old and viscous substances which cause pain and inflammation. It has many factors, and fatigue is a factor for this. Fatigue will do lactic acid accumulation, and it should be washed out of the body with this washing machine. Inflammation causing substances should be washed out with this washing machine. Internal bleeding should be washed out with this washing machine, and sarcogenic substances should be washed out with this washing machine to make our body healthier, to make our lymphatic body healthier. Now, if the movement of the interstitial fluid in the tissue cells can be facilitated by kinesiotaping application, the motor of our body washing machine will be reinforced, will be increased. You are all familiar with this slide and with this concept. If there is a trauma, there will be a pressure, there will be an edema in there. Edema will cause pressure, edema will cause compression in there. And if you apply kinesio tape, you can rise the distance between epidermis and dermis, and which will provide us better lymphatic fluid, better lymphatic channeling, better lymphatic circulation, which will make edema go away from there. Kinesio helps tissue capillaries, nerve endings, and skin layers to return to their healthy function. You can see in this research, this is very clear. Kinesio tape increases the space between epidermis and dermis. You can see this is an histological section. You can see the epidermis here without kinesio tape and dermis here without kinesio tape. With kinesio taping application, you provide convolutions there, as you are very familiar with. If you provide convolutions, you can see in the histological section that you increase the space between epidermis and dermis. This is a very good proof for that. Now let's look at the kinesiotaping applications done for edema. What can we use for edema correction? This is a jellyfish application. It is an EDF application. EDF is applied with thinner kinesio tapes, and this is a jellyfish application with providing a jellyfish effect to pump the edema from the skin, from the tissue. This is an EDF kinesiotaping web cut application. You can provide space with this at the area of trauma, at the area of edema. This is a space correction. It is very common used. It is an old application, but we use it very much. And with this application, you can create a space between epidermis and dermis, and you can channel edema from there. You can create space. With lymphatic correction, of course, fan cuts, you can provide a good edema control. You can provide lymphatic channeling. You can provide lymphatic correction. You put the anchors on a more congested area of the tissue on the body, and you put the tails to the edema region. You have to provide a cage here, as you see, and you can just provide lymphatic channeling and lymphatic increase lymphatic circulation with this, and help edema to go to venous system more easily. This is a snowflake application. It is a new application, and you can provide maximal use of natural hydrokinetic fluid layers with this. It is cut like a snowflake. It is very, very, very light stimuli, and you can use it with paper off or 20% of tension. It is very light. It provides very light stimulus. Basket wave is also a good application, a common application we use for edema, and it is an old application. We can put it with 25% to 50% of tension, and it provides really good edema control according to our clinical patients. Now, this is a lymphedema application. As I said, lymphedema is another issue, another thing to be considered. And I think there is a presentation about lymphedema in this conference, so I'm not going to get into it too much, but you have to follow the lymphatic nodules, the lymphatic veins, and water sheets with if you are dealing with a lymphedema patient, and it has to be circled, and it provides very good edema control with complex decongestive physiotherapy. Now, which tape should be used for edema? If you ask something like that, we can control edema with most of the EDF tapes. If you are doing an EDF tape, then you can use Kinesio Gold fingerprint best with this. So you can use Kinesio Gold fingerprint with edema as the best. Of course, whatever you have in your hand will work. You can use Performance Plus for Snowflake, but Gold FP will work better with EDF, it is said. Now, let's look at, does it really work on edema? Let's look at our first question. Does it really work on edema? Let's see the literature about this. Now, this is a good research about this. Edema percentage in dermis area. I will translate it to you because it's in Turkish. This is the percentage of edema. Blue ones are without the tape. Orange ones are with the tape. This is the result for 30 minutes with kinesio taping application. This is without tape, 30 minutes, and this is with kinesio tape, 30 minutes. This is the result for 6 hours. After 6 hours, kinesio taping application. Blue one is without the tape, 6 hours, and orange one is with the tape, with kinesio tape, 6 hours. Looking at the third chart, this is the results for 6 hours with a placebo tape, with a rigid tape. Blue one is without the tape, and orange one is with the tape. You can clearly see that kinesio tape in same hours, this is kinesio tape, this is placebo tape, decreased edema very, very much from placebo tape and from without tape results. You can see the effectiveness of kinesio tape in edema in this study very much. Now, there are many studies about this in the literature. This study is about lymphedema, and we had put these kinesio tapes under the compression bandaging in complex decongestive physiotherapy, and we saw that it is very much decreasing the edema with kinesio tape. There is also a research we have done newly with ACL, anterior cruciate ligament surgery patients, and these patients were applied postoperatively sterile EDF kinesio tape, and we could see that after 72 hours, the operated leg was as same as the healthy leg. After 72 hours, there was no edema, no nothing. So it was very helpful, very useful for our research. We could decrease edema with this. There is also a research about this, kinesio taping and compression stocking on pain and edema and functional capacity of chronic venous disease patients. And these patients were very controlled with edema, and kinesio taping application also made edema decrease in these patients too. This is also an ACL study, anterior cruciate ligament reconstruction patients. Applying kinesio tape, lymphatic correction is applied here, and they had very good edema results. They had very good edema decrease in these patients, as we had seen. Not only humans we are taping, also horses and animals we are taping. This was a good research of us. The horses had abdominal surgery, and after that, postoperatively, we had taped them with Acune tape and with EDF application, EDF web cut application. And we had seen that in 48 to 72 hours, the edema was very decreased. We had a control group, which we had not taped. So they were very swallowed, and Kinesio horses were very decreased in edema. And there was also pain was under control, and the horses were very happy, and the owners were very happy, and Kinesio tape helped us to decrease edema with this too. I am very thankful for your patience. You can always contact me with my email, and again, I would like to thank the organization committee for inviting me and for this wonderful event. Thank you again. Now I wanted to show you some additional information about how to apply kinesio tape for edema. For example, we have pre-cut fan cut tapes. You can use it for edema to make a cage. There's a patient of us here. Now, if you have an edema here, you have to channel this edema to a more congested area. If there is a trauma, if there is a mechanical low back pain, if there is an edema and you can feel the edema here, you can treat it like this. Now, you have to put the anchors on a more congested area and put the tails in the place of edema. Now, it is a little bit artistic thing you can apply. You have to make a cage for this edema. Now, the second tape is going to go from a more congested area to the place of edema. We apply it without tension, with paper of tension. It is 15 to 20%. You have to cover all of the place which has edema in. Now this means you have edema in here. This is a lymphatic correction for edema situation. Now, let me show you how to cut snowflake, as I showed you in my presentation. We are going to apply a snowflake to here, for example. We are just measuring how much to apply, how much tape to apply. We are rounding the edges. Now you fold it into two, then you cut two cuts here. You open, you fold it to the middle, then you cut two. You fold the other one and cut two. Now you have a beautiful snowflake here. I will apply it from proximal to distal to make the edema come to proximal with 20% of tension. Now, I am going to open these snowflakes. Now, there is another thing I want to show you, I want to share with you, is to how to do the jellyfish EDF technique. Now, can you turn? Okay. Now, let's think that there is an edema in here, in the shoulder, which we use very much, which we use very often. There are many patients coming to us with edema on the shoulder. It can be an instability patient, it can be an impingement patient, shoulder impingement patient, it can be a trauma patient. The patient could have fallen onto the shoulder and there should be an edema in here. Now we measure the place we want to react. We cut two tapes of it. Now you just cut an eye here and also an eye to the other one. Now you can cut tails here. How many tails will you cut? It depends on which technique you want to use. If you want to use EDF epidermis taping, then you have to cut 8 or more. If you want to use dermis taping, then you have to cut 6 to 8. If you have to use fascia taping, then you can cut it into 4 and 6. 4 to 6. It depends on where you want to affect. Now I'm cutting it into 6. To affect dermis, sorry. I'm cutting it into 6. This could be an subacute patient, because if the trauma is acute, then it will be more on epidermis. If the trauma is getting chronical, it's getting subacute, then it will be on dermis and fascia. Now I have something like this. I have 6 tails, a hole, and 6 tails. Now we are putting the hole, the eye, at the center of the edema, and we are spreading the tails. We are spreading these tails without tension, because if you are doing any dipping, then you have to do it paper off. Now for the second one, we are applying this one right vertical to the other one. Then I am spreading the tails again. Then I have a shape like a sun. Can you show? I have a shape like a sun here. Now I am going to put an EDFI tape to round this sun to make it a jellyfish. I am going around my all tails You can use another one, another eye tape if it's not enough. I am covering all of the tails. It's not important that you round it twice. It's important that all of the tails are getting in, and it will affect like a jellyfish. With the movement of the skin, with the movement of epidermis, the tape will act as a jellyfish, as a pump to the edema. Thank you so much. Hi. I will just answer these questions here. Thank you so much again for listening. There is one question. It says kinesio taping works on decompression effect. Does application of compression bandage over the kinesio tape nullify the effect of taping mechanism for fluid dynamics? This is a very common question coming with these our research, and it is discussed in the discussion section. I can send you. You are absolutely right. Kinesio raises the space, and compression bandages is on it. How can we see an effect? We have taught this as kinesio applied to the skin with movement, with exercise, with any movement will increase the mobility of the fascia, will increase the mobility of that fascia fibers, which are also pumping the lymphatic fluid to the lymphatic system again. What we see is, with kinesio taping application under compression bandaging, we have seen that it is very it becomes very soft edema, and it is very easy to go away. It becomes very easy to go away edema. It doesn't just sit there. it doesn't just stay there. And with kinesio taping, with the mobility of the fascia, it becomes very easy to go edema. I hope it will help. Another question is, why do we do fan cut taping? Fan cut taping with applying cage is especially done for edema, which is not lymphatic edema, and which is not a lymphedema, with acute edema, with normal edema, with post-traumatic, post-surgical edema, which the lymphatic ways are healthy. The cage at the fan cut will affect the place of edema. It should be applied like that, as you can see in the video. Another question: this taping is for edema reduction only or for pain also? Yes, of course, for the pain also. Every application will affect pain with edema, of course, you can use. And I think these are all the questions.
Okay, Dr. Nihan, I would through your this thing live stream, I would tell the viewers that those who have any questions, they can put in the comment section, and Dr. Nihan will personally address that questions in the comment section. And from my side, Dr. Nihan, I'm thankful to you that you have accepted my invitation on a very short note, and there is a really wonderful presentation on edema, and thank you so much.
I want to thank you too for inviting me, and it is a very wonderful event, a first in the world event with kinesio taping, and I want to personally thank you for doing it and for inviting us.
Thank you.
Thank you.